Okay, so a lot of people are asking a lot of questions also. Someone actually asked what daddy can help on baby jaundice despite of mother kept breastfeeding the baby. Hello, hi, what's up parents? Welcome to What's Up Parents, brought to you by Henny Malaysia. Now today is episode 5 already. Pejam celik, kita dah sampai ke episode yang kelima. What's Up Parents is actually a talk show, a very santai-santai, very chill punya talk show. Alright, now brought to you, especially tailor-made for all mummies and daddies to share ideas with you, to share tips or whatsoever regarding to parenting, regarding to breastfeeding and all the topics lah. Okay, now if you have any topics that you think that is disturbing your mind, rasa macam I tak faham benda ni lah, I need help lah, I need someone to actually guide me, to prep me to be a better mommy, to be a better daddy. Okay, please feel free to actually drop your comments in the comment section down below. And every week, okay, if you are here with me, you will notice we will discuss different topic every single week. Now this particular week, we will actually talk about newborn jaundice. Sekejap lagi kita akan bawakan pakar, okay, someone that actually ada orang kata apa, rights to actually explain why newborn jaundice, why not just jaundice sahaja kepada anda semua yang ada dekat rumah. Jadi harap topik ni akan membantu, okay, ibu-ibu ataupun ayah-ayah ataupun ibu dan ayah yang soon to be nanti. Are you guys ready for our topic today? Newborn jaundice? If you are, okay, make sure you duduk diam-diam dekat rumah. Okay, stay tuned with us. Now, enjoy the video that we have actually prepared for you. Okay, I'm sorry if let's say that particular video ada a bit disturbing to some mummies or daddies. I don't know about you guys, but it's a bit disturbing to me because I pernah go through that. But I believe banyak mummies and daddy also pun pernah go through, not only me and some of you who are here. Okay, so we are not only that, today kita dekat set ni, okay, bukan Fiona saja seorang dekat sini, Fiona juga ada bawa kawan datang. Seorang kawan yang pernah experience newborn jaundice. Until one tahap yang boleh cakap macam slightly critical lah, kan? So yes, we have May here with me today. Hello, hi. Everyone say hi to May. Or any May's friend outside there can actually say hi to us. Although we cannot hear you, we can actually read your comment, read your hi in the comment section. So maybe May, you can introduce yourself to our audiences today.
Okay, I'm just a mom and working as a teacher. Yeah, so my daughter just turned 1 on Sunday. Yeah.
Okay, she's 1 year old now lah.
Yeah.
Okay, so actually like can you actually tell us more about your daughter's jaundice condition?
When she was born, I heard before that many babies will experience jaundice, and then I also kind of jaundice. Never mind. At least I know what I have to do. That I have to, because first day, second, and then third day.
But before that, you heard about jaundice from who?
From who? From baby talk, from everyone's, because it's very common among the newborn babies. Yeah. So, yeah, from.
And then when did you start to discover that she actually have jaundice?
The second day after she delivered, we will go back to the hospital to check the jaundice level. It was not ideal. It was a bit tinggi lah, but not sangat tinggi. But because I have to follow up, because it's very strict in the government hospital. So first day was tinggi. I booked the confinement center. I wanted to go. I said I will come in this day because I'm ready. My baby is still ready. But because the jaundice level was high, so I cannot go into the confinement center. So I have to stay in the hospital with my daughter because she needs to receive the phototherapy. Then only a day. And she was okay, so discharged. Yay, can go confinement center. Yeah.
But maybe some of the mummies and daddies out there kan yang tak tahu pasal apa phototherapy. Fototerapi tu bukan ambil gambar, cuci gambar tu it's not phototherapy is actually a machine yang dia keluarkan, pancarkan the blue light lah. That is the machine diguna pakai seperti mana yang anda semua nampak tadi dekat video yang kita tunjukkan, yang ada satu mesin dekat atas tu dia turunkan, dia pancarkan lampu biru. Usually macam kalau if I'm wrong, maybe nanti doktor try to betulkan so bila baby orang kata macam disahkan satu tahap dia punya jaundice yang tak memuaskan, baby-baby tersebut akan diletakkan, disorongkan ke bawah lampu biru yang kita panggil phototherapy machine untuk kononnya kita panggil jemur baby lah. Right?
Yes.
Kita panggil jemur baby because like this one. Because it is very hot.
Yes.
It is very hot, very warm lah.
Yeah.
Kita panggil warm lah actually.
Yeah.
Now, why I explain this because I believe like memang jaundice, ramai mamis yang tahu, okay, jaundice is very common. But you don't know like deeply about jaundice kan? Okay, so what happened after that? Macam you discharge already?
That day, right? Okay, so continue to monitor, and then it was tidak memuaskan lagi.
Still,
so go back to hospital again. Sorry, not hospital. It's just clinic kesihatan. No need to go until hospital yet because just to check the jaundice level. Until the 14th day, it still tidak memuaskan. So prolonged jaundice.
Until the 14th day.
Yes.
What was your reaction when macam every time bila macam you pergi hospital, pergi klinik kan? Tired.
Yeah, and then I want to know what happened as well because kejap kuning je sebab jaundice in Malay term also kuning kan. Kuning ke I nampak okay je, kulit je cantik.
Okay,
kuning ke.
Your baby punya kulit masa kena jaundice tu does it like obvious look very kuning?
Dia tahap tak tinggi sangat, cuma tinggi lah. It's not very high as in like critical, it's just tinggi. But then the problem with her was her pale stool. The stool should be yellowish, like golden color, but hers was quite pale. Yeah, so that's the problem that the nurses told me in the confinement center because I was a newborn mom. I thought stool is just stool. Kenapa kuning pun ada beberapa jenis kuning.
Betul.
Even in the stool have to be golden color or a bit pale. So the pale stool was abnormal. Yeah.
Okay, so this is one of the factor that mummies and daddies also kena orang kata apa, ambil tahu, especially for mummies and daddies soon to be lah, sebab nanti boleh monitor other than your baby punya physical, okay, your baby punya stool you pun kena monitor betul-betul. So after that what happened?
On the 14th day she had pale stool, so we took a blood test in the clinic kesihatan, and then the blood test result was back quite fast.
How fast was it?
Oh, next day.
Oh, okay.
Yeah,
good.
because I remember next day was Friday, and then the doctor straight away called me. I think this is quite serious because in the blood test had a lot of things tested. The direct bilirubin was astonishingly high. So the doctor called me directly. We suspect there's some blockage in the organ or something, so you have to come back on Monday because it's on Friday. They don't work on weekend. So I was the doctor explained to me through the phone. She told me the possibility of this direct bilirubin was very high, and then okay lah, we go back to clinic kesihatan to further check up. Then straight away to do a ultrasound in HKL. Yeah, so she was very hungry. To do ultrasound, she has to fast for 3 hours without milk.
Okay.
So she was but no choice because if it's full, the bladder
you can't
is full.
see anything.
Yeah, we can't see anything. So she was in starvation, and then we did the ultrasound, and yeah, that's what we know what happened, what's wrong.
So after you did the ultrasound, then the doctor actually confirmed,
yes, there's a choledochal cyst.
What is that?
Choledochal cyst.
Choledochal cyst. What exactly is that?
It's a cyst that called choledochal. I think the doctor can explain later. If the cyst were to grow bigger and the jaundice level is too high, it might cause her to have liver damage. So yeah, if liver damage, have to queue for liver transplant. So that time it was like, so small, and then have to do an operation to remove the gallbladder. Then we went for second opinion because we like, confirm we don't want to do this surgery. And then it was very urgent because if late a bit, we don't know what will happen.
Yeah.
So we went for a second opinion, and then the specialist also confirmed that this is urgent, it need to be done, and you go to the right place.
I think it's the right time for us to actually jemput our another guest, okay, virtually dekat alam maya bersama dengan kita. Okay, sebenarnya kita ada Dr. Joanne bersama dengan kita. Hi Dr. Joanne. Can you hear us?
Sekejap,
Dr.
Hello
Joanne.
everyone.
Hi doctor. Doctor, where are you now?
Hi, I'm in a very safe place. I'm at home right now.
Doctor, since we have a lot of questions regarding to this newborn jaundice kan, mungkin kita boleh start dengan soalan pertama lah, because just now, like I mentioned earlier, today our topic is newborn jaundice. So some of our audiences actually ask, hey, newborn jaundice, maksudnya adults pun boleh ada jaundice ke apa? Kategori of jaundice ni, mungkin doktor boleh explain a bit.
Okay, so first and foremost, I think it's very important to know what newborn jaundice is. So newborn jaundice just refers to the yellow color seen in a baby's skin or eyes. So it's referring only to babies, especially within the first 2 to 3 weeks of life. So to answer your question is, after newborn jaundice has resolved, basically the same jaundice does not come back anymore. But as a child grows up, goes into adulthood, if you get certain infections, for example, hepatitis A, yes, you can develop jaundice, but the cause will not be because of newborn jaundice. Newborn jaundice has different causes for it.
Okay, newborn jaundice ada different causes, but what actually causes that? Why does baby actually develop jaundice?
Okay, so as I've seen in the comments as well, a lot of people have written, and in fact, May has also said herself that she knew that jaundice was pretty common, right? Yes, it's actually very common. It affects about 75% of babies. And why is it so common? Because babies, they have a lot of red blood cells, sel darah merah, and these red blood cells have a very short lifespan. So because of that, it tends to break prematurely. And when it breaks down, there is a pigment called bilirubin that will be released into the bloodstream. So this bilirubin, in excess, it will go to the skin, it will go to the eyes, and it will give the baby the yellow color that you see.
Like from a doctor point of view, maybe doctor can actually explain it to us. Okay, maybe some of the parents, they tak tahu, when exactly does a baby develop jaundice?
Okay, that's a very good question. So usually babies develop jaundice anytime from the 2nd day to the 4th day, and it will continue to peak till the 5th to the 7th day before it starts coming down and disappearing within the first 2 weeks or 3 weeks. So it's very important for parents to know that jaundice in the first day itself is totally abnormal, and babies having jaundice on the first day itself needs to be investigated, and treatment needs to be started as soon as possible.
Okay, how does actually jaundice measured in a baby? Because we know it's like got different bacaan one, right?
Yes, correct. So, of course, there are many ways to assess jaundice. Like if you see some of the nurses who comes and visit mothers after delivery, you notice that they just look at the baby and then they will apply direct pressure on parts of the baby body, and then they will tell, okay, your baby is jaundice up to the chest level or up to the abdomen level. So this is what we call a visual assessment. So this is just a screening method, but at the end of the day, it won't tell you what is the bilirubin levels accurately. So then we come to 2 other methods of measuring bilirubin. One would be through the skin method, where you use a device. I noticed just now you showed some pictures, right? So a device to measure the bilirubin pigment on the body. Now the second way, or the most common way, is to measure it through the blood.
What is the severity of jaundice, and why is it dangerous to a baby?
Okay, so most of the time, the good news is jaundice is harmless and it resolves without any intervention. That means you no need phototherapy whatsoever, and the jaundice just gradually decreases and basically resolve by itself lah. But there are certain cases whereby a baby develops severe jaundice. Severe jaundice is a different thing altogether. It refers to condition whereby the bilirubin increases to a level which is very dangerous to babies. And why are we so worried is because the higher the bilirubin level is, the higher chances that it can go into the brain and cause serious injuries. So in babies with severe jaundice, sometimes we can see certain symptoms. For example, the baby refuses to drink milk. The baby also appears to be sleeping more than usual or crying, and you find it very hard to calm the baby. So these are all the early signs. So why we want to detect a baby who has severe jaundice is because we don't want them to develop serious brain injuries that can result to things like cerebral palsy, blindness, hearing defect, mental retardation, and developmental delay. Because as a child specialist, it's very sad to see any child suffering from the consequences of severe jaundice because it is totally 100% preventable.
Doctor, maybe you can also tell us what are the treatments available in a child if, let's say, the child actually got jaundice?
So the mainstay treatment will be phototherapy, like as you mentioned earlier on. Phototherapy is a process where a baby is exposed and shined with a special blue light. So what this blue light does is it is absorbed by the skin, and this blue light helps to break down the bilirubin pigments into products which are easily removed by the body through the urine and through the poo. So of course it's very safe, okay, but then saying that it has to be closely monitored. As you mentioned just now, right, when you first had the experience of your baby being placed under the phototherapy, you were wondering it's rather hot, whether the baby will feel comfortable or not, things like that. So yes, these are the things that we need to monitor. Temperature is very important. Number two, if you notice as well, when your baby had her phototherapy, was also an iPad that was given to cover the eyes, because the blue light is actually harmful to the eye, so we don't want any eye damage as a result of it.
Now, maybe doctor can also share with us what's next in a baby's jaundice. If let's say, kalau the jaundice doesn't resolve, okay, by the 2nd or the 3rd weeks.
Okay, so usually for jaundice which does not resolve by the 2nd or the 3rd week, this is what we call as a prolonged jaundice or kuning berpanjangan. So in this case, doctors will order certain blood tests and certain urine tests to make sure that the baby's jaundice is not due to underlying conditions, for example, blood disorders, low thyroid hormone level, any liver disorders, like for example in May's child, her child actually had choledochosis, which is one of the contributory factors to the prolonged jaundice. And last but not least, infections as well, especially urinary tract infections, jangkitan air kencing. So it's actually quite silent in babies, and one of the early signs would be prolonged jaundice.
So maybe doctor can actually tell us whether this particular statement is actually, if let's say your baby ada jaundice, Kang, it's okay. Carry your baby, go out of the house, okay, jemur-jemur sikit, then your baby will be okay. Okay, apa pendapat doktor tentang that statement?
Okay, I think this one is quite a cultural belief because in fact I have 3 kids as well, so even my mother-in-law also used to tell me to do that. But the thing yes, but the thing about jemur your child under the direct sunlight is, number one, we have to remember that the baby also has very thin skin, and number two is in the sunlight it also has harmful UV rays, so you don't want to actually expose your baby skin to these UV rays because your baby skin can get sunburned very easily. The other reason is because your baby also might overheat and your baby might lose actually water through sweat. And actually dehydration also worsens jaundice. So instead of actually trying to reduce the jaundice increases because the baby is losing water from the body.
Okay, let's say your baby got jaundice, right? So mummies that are in confinement, you are not supposed to actually drink any herbs because the herbs will actually increase the baby's punya jaundice level. Is that true?
Okay, so about these herbs and all, right, actually, well, not much studies have been done regarding the intake of herbs and all. I would say that one of the closest one that we know of is not to take too much of ginger during confinement because that can actually raise jaundice level in a baby. But I think the main concern about herbs is especially for babies who are G6PD deficient. There are a number of herbs that can cause the baby's red blood cell to break even faster, and this will cause the baby to have severe jaundice.
So now we also do heard before that feeding baby with water, newborn baby with plain water, with grape water or chestnut juice can help to prevent jaundice. So apa kata doktor?
I think this is one of the most dangerous practice among all because a baby's digestive system is very immature. Besides taking in milk, it cannot process any other food. So when we actually give baby any other food besides milk, what we are doing is we are exposing the baby's digestive system towards injury and inevitably infection as well. And some of these infections can be quite fatal, requiring even surgery to actually remove infected bowels in the babies. We have seen a couple of these in the hospital as well.
Okay, so a lot of people are asking a lot of questions also. Someone actually asked, what daddy can help on baby jaundice despite of mother kept breastfeeding the baby?
Okay, this is a very good question. Now we must clap hands for this daddy.
Clap hands for Nazrin Nordin.
Okay, so what I can say is obviously daddy can't breastfeed baby. Okay, that's for sure. But this is very important for the mothers because as mothers, right, we are multitaskers, and most of the time, right, this could not be our firstborn. We could have have other children as well. So we tend to breastfeed our child and then not having enough sleep throughout the night. The next day continuing on with housework, things like that. All so we would really appreciate it if daddies just give mommy some time to rest as well. So meaning to say, after mommy breastfeeds the child, you take over, you burp the child, you rock your child to sleep, things like that. That will give mommy at least an extra hour or two to rest. So that would be really good.
Okay, doctor, maybe the best treatment, the best advice for parents out there, okay, who are maybe sekarang, don't know, baby are having jaundice. What are the best solution for them?
Okay, I think for me, jaundice is pretty much harmless. But saying that, it's very important for parents to make sure to monitor the jaundice level, especially in the first 1 week of baby's life, because we know that is the time that the jaundice can increase rapidly. Now, the other thing is to feed your baby. If you're breastfeeding your baby, feed your baby on demand. And I do believe that, every mother and every baby should be able to breastfeed effectively before they are discharged back home, because that's very, very important.
Thank you to our guests. Thank you, Dr. Joanne. Thank you, May. And also thank you all the mummies and daddies. We'll see you again next week. Bye-bye. Thank you for watching. Now remember, if you have any comments, don't forget to leave it down here below. Or if you have any topic that you would like us to share about with you, leave it down here below also. And don't forget to subscribe. If you would like to watch more videos, click here.